Hey guys, Dr. Quinn Henoch here. We're sitting inside of Juggernaut headquarters with Johns and Kevin Torres, two high-level powerlifters who are having issues getting underneath the bar for a back squat. They're having some shoulder, some elbow issues, and some range of motion issues just in general going into that low bar position. And I know a lot of you guys can have some issues with this as well. As we go from a high bar to a lower position, we've got to kind of crank back, and it can be a rather difficult position to get into. And so we'll start by just going through some simple range of motion drills and mobility drills for the T-spine, for the shoulders, to take some pressure off of the elbows. Because if I look at Jake's elbows, so I'm just going to bend him. That's full range of motion. I'll straighten them. That's decent lockout, okay? I'll take this other side. Just bend it as far as you can. That's normal range of motion there. Straighten it. Decent lockout. Any pain there? No. So that doesn't elicit the same elbow pain that you get when you're squatting? No. So range of motion wise, his elbows are intact. And so the question is, well, where does the elbow pain come when he's squatting? Well, it must be because we're restricted up top, and then he has to crank on his elbow to get that extra range of motion. And so we'll deal with addressing the T-spine and the shoulders, okay? And we'll check Kevin. Good. That's good lockout. Any pain there? No. Same thing. Lockout. Any issue with that? No. Okay, good. So again, we'll address shoulders and T-spine, and then the elbow will kind of relieve itself. It's more of a victim in the whole situation. So we're going to start with these guys on the quadruped position. So we're going to go hands and knees. You can use an ab mat to kind of protect your kneecaps if you're sensitive here. And this is a pretty common drill to get thoracic spine mobility. Okay, so what these guys are going to do is they're going to breathe in through their nose, all right? When they exhale, they're going to exhale through their mouth, and they're going to push away. So try to get away from my finger. Push away up to the ceiling. Yeah, like that. So you're actually going to flex, all right? No shrug. Relax your upper traps, and then get away from my finger here. Don't touch my finger. Up, up, up. There you go. So we're getting this, restoring this curve here. Now, take some nice deep breaths in there. We're trying to open up that upper back. Again, try to get away from my finger. So yeah, just like that. Put air there. Nice big deep breath. We're trying to expand the lateral chest walls, trying to get expansion through here. When you exhale, come back down and try to sink into your shoulder blades. So squeeze your shoulder blades together at the bottom. It's not a shrug. It's a squeeze here. Yeah, so down, sink into your shoulder blades. Good, and then breathe in, exhale, and reach away. And so we're taking our T-spine, and we're going from this position of flexion to extension, flexion to extension. That's much different than arching our lower back, okay? So we're trying to keep our lower back stable, and we're trying to get the movement through our upper back. So yeah, good, sink in between your shoulder blades now. That's it, and now go the other direction. You'll flex. So we're pushing away, and you'll find that it seems counterintuitive to think that we need flexion in order to get under the bar, but if you can restore this position, then you've got more slack from which to extend, okay? So 2 sets, maybe 8 to 10 total reps. You may even get lucky and get a couple pops and cracks in your upper back, which is always nice. Go ahead and lay on your back, guys. The ab mat is the pillow, so to support your head, making sure we're not cranking on our neck. And now we'll work on straight up shoulder movement, okay? So I'll have you guys breathe in through your nose, feet flat, bend your knees up, feet flat. There we go. So breathe in through your nose, exhale through your mouth all the way. All the way, 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 more. So abs. We're looking for an abdominal contraction when we exhale. That's gonna set our rib cage to neutral, okay? I want arms up to the ceiling. Here, just like that. So these guys are gonna breathe in through their nose. As they exhale, 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 exhale through your mouth all the way. We're gonna reach our arms over our head in kind of a Y position, okay? As far as your range of motion will allow. Well, we're doing it as we exhale so that it keeps those lower ribs down and we're not compensating through our lower back, all right? So back up to the ceiling, breathe in, exhale through your mouth, exhale, 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 as you open up. Good. Now, Let's get 4 or 5 reps there, guys. Now, for somebody with a lot of soft tissue restriction, especially Jake, you know, deep soft tissue work is obviously indicated here. Foam rolling, all that stuff is very, very useful, okay? But in order to knock down that tone, so you need that stuff to knock down the tone, but then you've got to use it actively. It's one thing to just get a massage, yeah, I feel a little looser, and then just try to cram yourself under the bar. It's another thing to use those implements to knock down tone, but then you use it in a more low-level position like this, where you can actually feel what it's like to move through your joints and you're not overloaded with hundreds of pounds, okay? So it's a good intermediate step. One more time here, guys. Breathe in. Exhale all the way. And then reach over your head. Now we can start to bend the elbows a little bit as if we were reaching back for the bar. Good. Back up to the ceiling. So we're looking at 2 to 3 sets of maybe 8 to 10 reps, okay? Exhale, bend the elbows, and then come back. Yeah, just like that. And so this is mimicking getting back underneath the barbell. And you may have limited range, and that's all right. A couple more reps. The more you do it, the more you'll knock down that tone, okay? Each rep should get a little easier. Exhale all the way, all the way, all the way, all the way, all the way. Good. And then back. And you're actively externally rotating the shoulders as if you were reaching back for the bar. Very last rep. Good. Reach back for that bar. Good. Keeping those abs activated. Perfect. Last step here, come over here to the wall. So we're essentially going to take what we did in supine and come into a standing position, because obviously that's going to carry over most to a back squat. We start on the floor because it gives us a lot of support and we can feel positions a little bit better. But once we master that stuff, we got to get on our feet for any type of corrective drill to make it stick for training. And so we can use the wall here to mimic the floor, but we're fighting gravity. And so these guys are going to stand maybe 8 to 12 inches away from the wall, okay? Slight bend in the knees to kind of give you some slack. And you're going to flatten out your lower back. It doesn't have to be completely flush to the wall, but maybe just like a normal arch. And so enough space for me to maybe get a hand between, but not an entire arm, okay? That would be overextension. And so what I want these guys to do, slight bend in your knees there, both. You're going to breathe in through your nose, and you're going to exhale just like we did on your back. And all that does is it sets your rib cage to neutral, and then you can just breathe and brace from that position. And so from here, we're going to go through the exact same ranges of motion. Okay, so slight bend in your knees, give yourself some slack. Good. Breathe in. Exhale. Exhale, good. And then reach. And then you can breathe in at the top and try to get expansion through the side of the chest wall, through the back. And then come on back. Breathe in. Exhale and reach. The whole time, the wall is your cue. And so your lower back, the relationship between your lower back and the wall shouldn't change. Okay, that should remain constant. What should change is your upper back. As I reach, 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 you can get tall through your upper back. That's much different than breaking through your lower back and overextending. So as you guys go through this, keep going here, several reps. As you exhale and as you reach long, think about getting tall between your shoulder blades as that upper T-spine where we want that motion, and keeping your lower back stable. It's going to be a lot of work. Bend your knees, give yourself some slack. Then we can start to reach forward and then bend the elbows. But again, we're getting tall through our upper back between our shoulder blades, but not breaking through our lower back. Okay, we want that arch to come from the rib cage and the T-spine, and that's where we're going to get that extra range of motion to reach for the bar. Go through this again. Come on, man. Stay with us. There you go. Good. Yeah, and then we can go here, just like that. Good. Come back down. Again. You will find that when you go through this stuff, if we do a test, retest of getting on the bar before you do anything, go through these 3 drills, these 3 positions, you'll find that it's then much easier. You gave yourself a buffer zone, okay? You're not going to make yourself the most tender of tigers right off the bat, but I guarantee that if you go to reach for the bar now, you're going to have a little bit more space, okay? Hopefully that makes sense, guys. This is Dr. Quinn Henoch signing out.